5/15, October is Breast Cancer Awareness Month. It is the most common cancer among women in America.
So let's talk about how to recognize it and the guidance for breast cancer screening. Our Abby Larico joins us now in studio to verify. Good morning.
Good morning. Such an important topic here. You will hear the phrase early detection saves lives quite often, and that's because doctors will widely agree taking action quickly can make a huge difference in breast cancer treatment and outcomes. So what's the guidance for how to detect it and monitor your breast health? Let's verify.
Our sources are several sets of guidelines and breast oncologist Dr. Claudine Isaacs, who points out
there are different guidelines from different groups.
A screening is checking for a disease before any signs or symptoms. For breast cancer, that typically means mammograms and physical exams. Those leading breast cancer organizations may recommend mammograms beginning at 40, 45, 50. Some will say annually, others say every other year. Those at highest risk might be encouraged to get a mammogram even earlier. Age, family history, ancestry, inherited gene mutations, personal health history, and lifestyle all could factor into how early, how often, and what type of screenings should happen. The National Comprehensive Cancer Network does recommend people have a breast cancer risk assessment by age 25.
What we're really trying to do is to figure out how to get more personalized at this.
Along with regular well-woman visits with a healthcare provider, the advice has long been to conduct monthly breast self-exams. Now, guidance on that is divided. Dr. Isaacs says it's most important to recognize lumps, bumps, changes in texture, or pain.
What is important is that people know what their breasts feel like. And if they notice something, that they go and they have it checked out.
She adds the best guidance for you will come from the healthcare providers who know you best.
Those are conversations that have to happen on a regular basis. The great thing about medicine is that our knowledge keeps on evolving and our guidelines change as a result. So because you had that discussion 10 years ago doesn't mean that it still applies to today.
And having these updated conversations may be especially important right now. As you know, hospitals around the country had to cancel routine healthcare appointments during the pandemic, which may have meant you skipped a year or two of screenings and regular appointments. So let this be your reminder, ladies, to get those appointments back on schedule.
Absolutely. I feel victim of that too, but I'm back on schedule now. Abby, though, one question before we let you go. Why is it that some recommendations actually push for less frequent mammograms?
That's a great question. A lot of people wonder about. So the big issue there might be false positives or the mammogram picking something up that's actually not of a major concern. And then the person has to deal with the kind of stress and frustration of that, possibly even deterring them from future mammograms, and that causes other negative long-term health outcomes. It's another thing you're going to want to talk to your doctor about, though, to assess your individual situation.
All right, Abby Larico, thank you for that.